Hi, my name is Lorelei Johnson, and I'm a speech-language pathologist and a researcher at the Center for the Study of Aphasia Recovery at the University of South Carolina. Today, I'd like to talk to you about a very exciting and popular topic in neuroscience today, and that is brain stimulation. In recent years, more and more research has explored the application of brain stimulation as a potential treatment method for aphasia. There are many types of brain stimulation, but today we'll focus on one known as tDCS. tDCS stands for Transcranial Direct Current Stimulation. That just means that a weak but constant electrical current is applied to the scalp and passes painlessly through the skull to stimulate the brain. The setup consists of 2 or more electrodes, a stimulator, and leads to connect the electrodes to the stimulator. Sponges connected to the electrodes are soaked in saline and placed on the scalp over the brain regions that will be stimulated. A rubber band or cap is used to hold the electrodes in place. The stimulator sends weak electrical current through the leads and to the electrodes, where the current then passes through the scalp and skull to the brain. Often, the stimulator is powered by everyday 9-volt batteries, and it usually causes a mild tingling feeling on the scalp once it turns on. However, there are some people who may not feel anything at all. tDCS works to make brain cells either more likely or less likely to fire. This depends on where you place the electrodes. For a brain region where lots of activity makes speaking or understanding more difficult, you might want to make those cells less likely to fire. Whereas with a brain region where there's not enough activity already happening, you might want to make those cells more likely to fire. There are some side effects that come along with tDCS, but they are usually mild or moderate. Some of them include itching or tingling, scalp redness, dizziness, nausea, fatigue, or mild headache. tDCS has been used for a number of applications, and research suggests that it may be helpful for a number of conditions, including depression and anxiety, Parkinson's disease, chronic pain, and of course, aphasia. However, it is not currently approved by the Food and Drug Administration, also known as the FDA, which is the agency that regulates medicines and medical devices in the United States. So is it effective for aphasia? Well, there is promising research that shows greater improvements for people with aphasia who receive tDCS paired with speech and language therapy. Greater improvement has been shown for people who receive stimulation on the left side or the right side of their brain. Researchers have also found positive outcome with stimulation that makes brain cells more likely to fire, as well as stimulation that makes brain cells less likely to fire. An example is a phase 2 clinical trial that was conducted in our lab to compare computerized language therapy plus active stimulation to the same therapy plus sham stimulation. 74 participants who had their stroke at least 6 months before the study received 45 minutes of treatment 5 days a week for 3 weeks. For those receiving active stimulation, it was applied for the first 20 minutes of treatment each day. For the sham condition, participants would wear the same stimulation setup as the active condition, but they would not receive the full 20 minutes of stimulation. Instead, they would only receive 30 seconds of stimulation at the very beginning of the therapy session to ensure that they all felt the initial sensation of the stimulation. This made it so that they did not know if they were receiving active or sham stimulation. Our results showed that those who received active stimulation showed greater improvement on items that were practiced in treatment, as well as items that were not practiced in treatment, compared to those who received sham stimulation. Despite promising research, tDCS is still not approved by the Food and Drug Administration or the FDA, and it requires even more research before that happens. There are many questions we still need to figure out, like how best to optimize the benefits from the stimulation. So, can we see even larger improvements if we change the duration, the strength, or the location of the stimulation? We also need to learn more about who would be most appropriate for treatment. For example, do people that have a certain type of aphasia improve more with treatment? Also, there is evidence that genetic factors may play a role in how people respond to stimulation. In addition to exploring these questions, there still needs to be larger clinical studies conducted before FDA approval can happen. While the research about brain stimulation is quite promising, we still have some way to go before you'll start seeing it used in therapy sessions at your local clinic. Thank you so much for joining me today to learn more about brain stimulation for aphasia treatment.